Hello, everyone. My name is Michelle Harris, registered nurse, and I'm here today to speak on the topic of COPD, in other words, chronic obstructive pulmonary disease. I thank you all for attending this learning session pertaining to COPD. This is the handout that I passed out to everyone in the audience. So as I speak about each topic, feel free to go along. So what is COPD? COPD is a lung and airway disease that makes it difficult for an individual to breathe. So the lungs and the airway, it makes it difficult for people to breathe. If you have been diagnosed with emphysema or bronchitis, you have a form of COPD. The number one cause of COPD will be smoking. Other causes include secondhand smoke. So if you're around a person who smokes and you're inhaling that smoke, you're at risk for COPD. If you live in an area that's full of air pollutions or have high levels of air pollution, you're at risk for COPD. If you're asthmatic, you're at risk for COPD. Also, if you have a genetic disorder called alpha-1 antitrypsin, you are at risk for COPD. Another risk factor for COPD is exposure to dust or fumes from work or from hobbies. There are other risk factors that people probably don't think about, but being over the age of 65, as well as being a female, puts you at a vulnerability to developing COPD. How is COPD diagnosed? There are many ways to diagnose COPD. One of the ways are through spirometry, and with this test, it's a breathing test that measures how well your lungs work. Also, a chest x-ray. It helps rule out other conditions and shows signs of lung damage. A blood test can be drew to check your oxygen and carbon dioxide levels in your blood. With people who breathe normally, they inhale oxygen and they exhale carbon dioxide. With people who have COPD or chronic obstructive pulmonary disease, they inhale oxygen, but they have difficulty releasing the CO2 in their body. So they inhale oxygen, but they can't let off that carbon dioxide like a normal person can, which leads to carbon dioxide buildup in the body, which is not good. If you think of it in a way as a toxin in the body that you can't get rid of. So now we're going to cover COPD prevention and treatment. One of the ways to prevent COPD is to not smoke. Another way to prevent COPD is to not live in areas that are high with air pollutants or to be around a lot of dust or fumes. Preventative measures for COPD is to use your medications as prescribed. If your provider prescribes you oxygen, which goes in your nose typically, and it's ran off of a big concentrator in the home, you want to use that oxygen when you're feeling really short of breath. You also want to make sure you're using inhalers that your provider prescribes to help with the breathing difficulties that a person with COPD may experience. Also, attend pulmonary rehab that helps you with skills to improve your breathing. And remember to stay up to date on flu and pneumonia vaccines. So now we're going to do a practice pertaining to breathing exercises for patients with COPD. A breathing technique that is used by patients with COPD is called pursed lip breathing. This breathing allows for people with COPD to inhale more oxygen. So the first thing you would do is to sit down. I can't sit down right now because I don't have a chair, but we're going to imagine that I'm sitting. I'm going to relax my shoulders, relax my back, and I'm going to just try to relax, and I'm going to breathe in. And then I'm going to exhale. Making sure when I breathe in that I'm keeping my mouth closed. So again, and exhale. Now I would like the audience to participate in helping me pursed lip breathe so I can make sure that you're grasping the concept.